So we back with another APPE rotation, and this month we at the St. Louis Forensic Treatment Center. Now I was at 3 different sites, South, Hawthorne, and North. Each of them serve their own purpose, but they all come together to treat psych patients. That's the original insane asylum. So pretty much on this rotation, North consists of patients who have committed some type of crime, but they've been deemed incompetent to stand trial. And we call that competency restoration, where pretty much we're trying to get them back to a level where they can stand trial. But if not, then we send them to the South location. That's a long-term site where they're deemed permanently incompetent to stand trial, and pretty much they stay there long-term or they get sent to another facility. And then Hawthorne is for our children and adolescents, and pretty much that's just a psych hospital. So on this rotation, I really did a lot. I learned about different psych meds, I learned about psych disorders, I did DIQs or drug information questions, and I really got to participate in these things called medication groups. So pretty much I would go on the unit with the pharmacist, and we would go and talk to the patients about their psych disorders as well as the medications that they're potentially on. So for example, it could be schizophrenia. We'll go and we'll say, hey, this is what schizophrenia is. This is what it does. This is how, it may affect you. And then here's the medications that could possibly treat that. And here's what you could be taking. And I think it's a really inclusive process. It's really good. It really shows the patient that, hey, not only do we care about you, but then two, we want you to understand why you're here, what you have, what you're taking. And it gives patients the opportunity to ask any questions that they might have about their treatment plan or their disorder. As you see here, I have Famous Amy's cookies for lunch. Dreams and nightmares, I was starving. I got my coffee cup. We making coffee at home now because save money, live better. You know what I mean. And on my last day, y'all know what I do. I bring in bagels or I bring in donuts. And of course, I had to bring in the bread co. This is the North and South location. Had to feed my people because they treated me right. And that's pretty much 7 out of 9. Rotation is complete. Stick with me for the last 2. Peace.